We do not get enough patients with bacterial vaginosis or recurrent yeast infections. There, I said it. And the reason I say that is because when we do get patients, they talk about how they've been dealing with this issue for years, like years. And this is kind of sad because it's quite easy to resolve most of the time. So the standard treatment for either bacterial vaginosis or a yeast infection is to give a medication that kills off whatever is the pathogen. So if there's an overgrowth of bacteria, then they'll get an antibiotic. And if it's an overgrowth of fungus, then they'll get an antifungal treatment. And it's usually the same one over and over and over again. And sometimes they're prescribed the same medication, but in an altering dosage. And sometimes it's really just the same prescription prescribed over and over again. And often it is a simple fix where really we need to focus less on killing off the bad things and growing the good bioflora. And this may be using an oral probiotic, it could be a vaginal probiotic, it could be changing the vaginal environment so that the good bacteria proliferates as it should. It could be more complicated and require changing the patient's diet and a few other things like that. And maybe we do have to use a different spectrum antimicrobial like a herb, either again orally or vaginally, to help resolve the issue once and for all. Because these women that are dealing with this symptom over and over again, usually they don't have to. Sometimes there's a super tricky case and it takes us a long time to sort it out, and we'll have to eventually do a combination of natural therapies and medication, but that's rare. For the most part, it's a very straightforward process.